Today I'm going to talk about gender reassignment surgeries. Prior to that, I am going to discuss the surgical techniques, what occurs afterward, why it is done, and the special technique we utilize. Why am I going to talk about technical stuff? We are providing you with a truly unique technique. So what are we achieving with this technique? We provide a delicate clitoris. I'm going to talk to you about a vagina that can orgasm without any depth or moisture problems, because this is one of the biggest problems. And most importantly, when our surgical process is visually completed, when it ends, and when our healing process is also completed, it will be so similar to a real female genitalia that it cannot be distinguished. I mean, what do we mean by similar? We're getting a new identity with an amazing sexual organ that can't be distinguished from the small lips and the outer large lips, namely labio minora and labio majora. So why are we having these surgeries? I think it's a type of surgery that is perceived very differently in society and also misunderstood. Our point is, if you had an arm situated in the middle of your face or a second chin, you would most likely feel uncomfortable and have the desire to eliminate this chin from that arm in order to alleviate the discomfort and restore a sense of normalcy. Because you do not seem to have a structure that is appropriate for a typical human anatomy, and individuals who experience this disorder can actually be categorized in the same group. Essentially, the mind and body of this individual are not in synchronization with one another. We actually reconcile these two with each other. We keep the balance in the middle thanks to these surgical procedures. Before we do this, we need to make sure of it first. You know what I'm saying? How can we be sure about this? So, is this some form of trauma, or is it the consequence of a different incident that occurred to you prior to this? The main important issue, and the issue that needs to be questioned in my opinion, let's say you're at home looking at yourself in the mirror. You have a spiritual sense that you inhabit a male body and experience an attraction towards individuals of the male gender. So the largest issue that individuals experiencing this disorder actually encounter is this. So you are in a different body, you experience a different sensation, and you genuinely have an affinity for both genders. This is a major problem, like seriously, well, individuals who experience this issue actually feel it since their childhood mostly. So it starts from the ages of playing games. The family is noticing this. The family starts noticing and putting pressure on the child. Perhaps you could consider visiting a psychologist if it is feasible for you. It is possible that the psychologist is once again exerting pressure on the child regarding their orientation, and these individuals who have undergone a transformation in their thoughts and physical appearance may feel excluded from society due to the way they look, think, and feel. They feel sidelined. It starts with the family, then it gets complicated. You can't fully grasp the concept of family as a kid, you know? This situation also reflects on his success in school. Most of the time, it comes along with failure, and these individuals are being excluded from society, pushed aside, and maybe living an inappropriate life where they are shoved to the side and living an unhappy life. We are guaranteeing the mental, intellectual, and physical unity and integrity through these surgical procedures. We are making peace. We actually assist you in making peace with your mind and body. These surgeries are hence very, very, very significant surgeries. Other than that, yeah, we do feel this way, but we have this need to validate it. Why? Because at this particular point, in actuality, a court decision comes into play. So, for instance, in our nation, Turkey, these surgeries cannot be carried out without a court ruling in any case. The court decision is crucial for us currently. So you're indicating that you have a feeling of being a woman in a man's body and you're initiating a legal action. I have made the decision to undergo gender reassignment surgery. I desire this. You are stating that you desire to persist in living in the manner you currently feel in your life. Of course, the court doesn't have the expertise to assess your health, so they're directing you to a fully equipped hospital. You're undergoing many procedures at the hospital you've been referred to. What are these? You're having tests from urologists to psychological evaluations for a while. You are undergoing hormone treatments. Therefore, do you truly require this surgery while undergoing this process? What is up? Are you presently in a state of confusion or what? So do you truly feel like this? I mean, is this the current state of your emotions? In reality, this is additionally approved and confirmed by a committee of experts. Similarly, for our patients who are coming from other countries, it is enough for them to finish this procedure in line with the regulations of their respective nations, where they live and hold citizenship, and to travel here with an official document issued by the authorized body to undergo this surgical operation in our nation. But we definitely need this article. Now let's get to the most crucial point of the matter. You are going to have a surgical procedure, and following this procedure, you will possess a physical body that is seamlessly integrated with the emotions you have experienced in your brain. There are numerous techniques for this, but the technique we recommend, stand behind, and support is of utmost importance. Why is it important? Because you can possess a sensitive, responsive, orgasmic sexual organ that is visually indistinguishable from a real vagina, so similar that you will not be able to discern the slightest difference, with no issues whatsoever regarding depth or lubrication, providing an incredibly realistic and satisfying experience. You can have an orgasm. I'm saying it again. You can have a vagina that can orgasm. There are many techniques. One of the techniques is to create a vagina without depth problem by removing the intestinal segment. In this technique, your penis is removed from its original location. A piece of the intestinal segment is taken and it is placed inside the vagina through a created opening. You do not appear to have an issue with depth, do you? Yes, you do not have any issues with humidity. Due to the fact that you can have a vagina that is adequately moist. However, if you were to inquire about the disadvantages, you are aware that our intestines break down the food we consume using the enzymes it produces. Well, this intestine is still an intestine. We did indeed remove it from its place and use some of it as a vagina, but these enzymes continue to be secreted. At a certain point in time, yes, it does provide the humidity inside, but it can also cause residue buildup and unwanted odors inside the enclosed space. That is the reason why we do not prefer this technique. Another technique that is widely used is the free flap technique. So, what type of vagina are we obtaining with the free flap technique? In this procedure, different areas of our body, such as the thigh, armpit, or inner arm, can be utilized. These flaps are harvested from various locations using microsurgical techniques, and a vagina is constructed using these tissues internally. Yep, we ain't got no depth problem. I agree, I accept, but here there's also an extra microsurgery. We cannot achieve enough moisture with this technique. Honestly, we are not particularly fond of this technique. But we know that good results are achieved in capable hands. One of the most frequently employed methods is the technique known as penile inversion. So what is up? We evacuate the contents of our penis and invert it, exposing the inner part to the outside. A technique that is really widely used. Well, if you were to ask why we don't prefer to do this, the biggest problem here is depth. Because we are striving to achieve a likeness to a genuine vagina. By the way, the individuals who employ this technique are highly content, extremely pleased. We are in pursuit of perfection. Perfect is perpetually the adversary of good, you know. By employing this particular technique, we are unable to achieve the depth that we desire and consider to be sufficient. Moreover, when we reverse the issue of hair around our penis, which is related to hair growth, it continues to persist internally, posing a significant problem for us. This situation presents challenges in terms of hygiene, smell, and maintaining adequate moisture levels, which greatly impact our overall well-being and comfort. That's why we're not opting for this technique either. The name of the technique we use is the butterfly flap technique. What's this butterfly flap technique? We're getting a sensitive clitoris, we're getting a vagina that can ejaculate, and if you noticed, we didn't mention inner labia in any of the techniques I mentioned before. Using this technique, we obtain inner and outer lips, so essentially there is no discernible difference in the anatomical appearance of a female genital organ. This is a technique that we acquired very closely. Well, if we were to provide a brief summary of this technique, we obtain a clitoris and labia minora from the sensitive upper part of our penis through a meticulous process. So we are obtaining the inner lips, and from the area of the scrotum we are creating our outer lips. To attain the depth within our vagina, we form the inner vagina by combining the tissues that are left from the area of the scrotum and the penis through the utilization of the grafting technique. After placing the pattern we created with our vaccination technique and flaps into the vaginal cavity, we complete our operation by making aesthetic stitches.